Action. Okay. My name's Kaylee Gibson. I will be performing a newborn head-to-toe assessment. We'll start with some general observations such as the baby's posture. They should be pretty flexed with their hands and fists and resisting extension. So if I try to pull them, they should be like, no! Just a little bit. But as we can see, my baby is pretty flaccid, which is typically seen in preemies. We would also be looking at the color of the skin. Some cyanosis in the extremities is not that bad after birth. That's a pretty common thing after birth for the baby to be pretty blue in the extremities, but my baby is all pink all throughout right now. And then we'd also be looking for any bruises, rashes, lanugo, vernix, feeling that the temperature is the same all throughout. This should be warm and pink. And we would also see in the skin of the baby, in a post-term baby would be very wrinkly and dry, and the nails would be longer in a post-term baby. And then next we would do some vitals. So first let's do the pulse. You wouldn't usually palpate the pulse, you would actually auscultate for a full minute, do an apical pulse, which would actually be at the umbilicus. So we'll listen for a full minute. And we're actually looking for about 120 to 160 beats per minute at rest. When the baby's crying, they can be tachycardic, about 180. And if the baby's in deep sleep, they can be about 100 beats per minute. And then we could also, while we're listening to the heart, we could also be watching the abdomen for respiration, so we should be counting that. And we can count that because with the stethoscope on there, you can actually see the rise and fall of the stomach, the breathing. You'll be able to see that in the abdomen and stomach, see that rise and fall. And we would want to see about 30 to 60 respirations per minute. The breaths can be irregular with some periods of apnea, about 15 to 20 seconds. That's normal, followed by compensatory tachypnea. And then we could also auscultate the lung sounds. Sound should be equal on both sides. It's also normal to hear some scattered crackles throughout in the first few hours after birth. And then we could do blood pressure. It's not normally part of a routine newborn assessment, but if we were to, we would want to do it in the upper and lower extremities. Sorry, I keep rubbing my tape on my little table. The systolic that you'd see is about 50 to 70 millimeters mercury, and the diastolic is about 30 to 45 millimeters mercury in the first 10 days after birth, about. Movement will increase that systolic pressure, or crying will increase that systolic pressure. We can also do a temperature. We could do an axillary temperature or a temporal temperature. So, I know. And the normal temperature you'd see is 36.5 degrees Celsius to 37.2. Next, we can assess the head. So, sorry, my ferret is drinking water. That's what that noise is. So we would be assessing the circumference of the baby's head. Normal is about 34 centimeters. This baby's head is 32 centimeters, so it's pretty normal circumference. Oops, sorry. And in the head, we would also be assessing the fontanelles. They should be slightly depressed. If the baby is crying, they can bulge a bit. Can also bulge a bit in caput or caput or cephalohematoma. Next, we would also assess the eyes. So we'd be looking at the color of the sclera. White is good, yellow might indicate some jaundice, but some physiological jaundice after birth is also normal. We'd be assessing symmetry. There may be some discharge because of the erythromycin eye ointment that we put in the baby's eyes after birth, so a little bit of discharge is normal too. The movement of the eyes should be random and jerky. Then we could assess the ears. So the ears, where the ear is attached to the head, should line up with the corners of the eyes. So you can actually see that on my baby here. Corner of the ear, corner of the eyes, right? Any dimples on the ears, because the ears and the kidneys develop at the same time. So if you see anything up with the ears, you might think about the kidneys as well. We would also be assessing hearing. We would also be looking at the cartilage. So what you'd do is you'd actually pull the pinna towards the head like this, and it should bounce back. We'll be assessing that cartilage. In a preemie such as ours, it might actually stick a bit before flopping back. Next, we'd be assessing the mouth. So the lips, gums, tongue, all that should be pink and moist. We're going to go ahead and stick a gloved finger inside the baby's mouth to assess the sucking reflex. And while the finger's in there, I can go ahead and feel around and palpate the palate to make sure, to feel for any cleft palate. And then next, we're going to go ahead and assess the abdomen. So we'll be looking at the umbilical stump, which should be white or gray in color and odorless. We'll take the clamp off in about 24 hours, and it should fall off on its own in about 2 weeks. We'll go ahead and listen to bowel sounds. And bowel sounds are present in all 4 quadrants, which is good. The abdomen is soft and round. We don't usually measure around the abdomen unless in preemies we're suspecting neck, so you would see a bigger abdomen in that. The chest, though, we can measure, if I can get this off of me. And the abdomen, not the abdomen, the chest, you would measure across the nipples. You would expect it to be about 2 to 3 centimeters smaller than the head circumference. The shape should be barrel shape, and I actually got 32 centimeters, so it's about the same. So but this is in fact a Cabbage Patch Kid. Disclaimer. So we'd be assessing for symmetry of the chest. Chest should be barrel shaped. We could also feel to see if there's any broken clavicles, which is abnormal. The breast may also be a little swollen and leaking a bit of milky discharge, which is as a result of maternal hormones. We can also measure length. I keep putting this back on even though I need to take it off. I might as well just leave it there. Since a baby might be squirmy, what you could do is actually mark on the table or whatever the top of the head, and then when the baby's squirming and stuff, we'll pull one leg extended and just quickly mark where the heel is, and then you can just measure those marks on the table. And a normal or average length for a baby would be about 46 to 56 centimeters. I have a short baby. They are a preemie though. And we can also weigh the baby. We would need the baby to be completely naked for this. So we would set down a heated blanket. So we'll lift the baby up, set down the heated blanket, then set the scale to 0 at that point because we don't want to measure the blanket. Set down the naked baby, heated blanket because babies are not great with their temperature regulation. And then a normal weight of the baby is about 2.5 to 4.5 kilograms. They do lose about 10% of their weight in the first week, and then they regain that weight in about 2 weeks. Next, we can assess the genitalia. In males, we'll be looking for the placement of the urinary meatus, which should be right at the tip. And we can also palpate the scrotum and palpate for the presence of both of the testes, which should be large, and the scrotum should be rugated. Both of them should be descended. In the female, what we'll do is we'll gently separate the labia and look for the presence of the labia minora, clitoris, and vaginal opening. In a preemie such as ours, we could have an enlarged clitoris. We could also assess We should also assess the rectum, and it should be patent, and there should be a presence of an anal wink. Next, we'll assess the musculoskeletal system. So we can assess the spine, which should be C-shaped, or more like that. And then while we're back here, we can also look at the base of the spine right above the buttocks to see if there's any cyst, dimple, or tuft of hair, which would be indicative of spina bifida. Sorry, let me put you back over. We would also be assessing range of motion. Shouldn't be hearing any clicks, and there should be full range of motion, equal movement in all the extremities, and strength. If we do hear clicks, or if we see like asymmetrical gluteal folds, then the hips may have been dislocated during birth. In a preemie such as ours, you would see reduced muscle tone. We could also do a Ballard score, which is how we assess for gestational age. So we could do posture, like I already talked about with the flexion, or just flaccid. You could also assess square windows, so we'd take the hand and pull it in like this, and then assess that angle. We could also do arm recoil, so you would have the arms like extend them and then push them in, flex them, and then see how they recoil. I don't know why I did the leg, sorry, I meant arm recoil. Push them in and then there. The popliteal angle would be, then we would do the leg. Push the thigh up to the tummy, and then you'll extend the knee, and then measure that angle. You could do scarf sign, which is pulling the arm across the body, across the torso. Also do heel to ear. Don't force it, just gently. Yep. And that's for gestational age. I think I already said that. We could also do some reflex assessment. So we could do the Babinski reflex. Let me get your little tootsies out. Oh, there, is it attached? Oh my gosh. Nope, there we go. And then you'll do like a little L across the foot, like that, and you'll see the toes actually react to that. So that's the Babinski reflex. I already talked about the sucking reflex with the glove finger in the mouth. You know what? I'm going to leave it like that. You also do the Moro reflex, which is also known as the startle reflex. You would not necessarily have to yell at the baby, but you could just do a little like that, and the baby will go, ah, with the arms out. Ah. And then you could also do the rooting reflex, which would be brushing the cheek, and the baby's head will turn that way towards it. So you go like that, and then the baby will turn with it. And then we could also do the sucking reflex, like I talked about. That is all.